We've been an organisation in existence since 1983, and originally we were a response to a community need.
In 2007 we won our first IMPACT Award, and that was like absolutely thrilling. But then, 4 years later to have won the Health Impact Champion Award is just stupendous.
It pushed them further and faster. We only have to see where they are now to where they were when they won that first award, which is incredible distance they've travelled.
When we first won in 2007, we measured the people who walked through our doors in hundreds. And now, in 2012, we measure the people who walk through our doors, so we now have 4 offices instead of 1. We measure them in terms of tens of thousands.
They've strived continually to think we need to be measuring outcomes, we need to learn from the outcomes, we need to actually improve our services based on what we learn.
This is what the BAS looks like, and it's a sexual health survey. Really what it is, it's an in-depth assessment tool that we use. So it gives us some really good, clear, concrete evidence of behaviour changes. And we also use the iBask, so that's on the iPod. And so when we're doing outreach, it's really to promote conversation, to get gay and bisexual men talking about the sexual behaviour.
So we thought we can actually market, we can sell some of the products we have, some of the ideas and innovations that we've tried, and one of them was peer mentoring.
This level of commitment to helping people try to stay HIV negative through a mentoring program, I'd never seen something like that before.
It's something that we're hoping, has a real impact, not just in the UK, but outside, to change, the rising HIV rates.
The Metro Centre was selected by the Department of Health to pilot innovative ways of reaching vulnerable African communities who were at risk of late diagnosis for HIV. And our idea was fundamentally around stigma. So we felt that if we embedded a HIV test in a fuller health screen, then it would take away the stigma of turning up for a test like that. And what they're able to identify is that the clinics that were run in community settings like ours had lower volumes of people coming through them, but higher positivity rates. So what that meant was that we were successful in reaching those people who were living with HIV but didn't know it.
They are without a doubt one of the leaders. I've never worked with an organisation that has responded so enthusiastically, even to difficult challenges, and delivered.
It's having a safe place where you can go, let off steam with people who aren't going to judge you.
It gives them the space to grow and to develop into who they want to be and not what anybody else wants them to be.